Okay, welcome to the deep dive. Today, we're taking a plunge into a really rich collection of sources. They give us this incredible window into recovery journeys. We're talking mental illness, substance abuse.
Yeah, it's powerful stuff. We've got this anthology full of personal stories from the Western Connecticut Mental Health Network, plus some really eye-opening data from Mental Health America on peer support.
And other inspirational accounts, too, right? And insights from NAMI, the National Alliance on Mental Illness.
Exactly. So our mission really is to unpack all of this. We want to pull out the key insights, the nuggets of knowledge.
Get a real feel for what recovery actually looks like for different people.
Precisely. What helps, what gets in the way, and especially the impact of support. Think of it as, a shortcut to getting well-informed on this, guided by these experiences.
Okay, let's dive in then. To really get recovery, I guess we have to start at the beginning, which is often, well, pretty tough. Painful, even.
Oh, definitely. The stories, especially in that anthology, don't shy away from the depths of struggle. It's raw.
And one thing that jumps out immediately is early trauma, right?
It really does. It's a recurring theme. Multiple people talking about abuse, starting way back in childhood. Joanna O'Neill, age 2. Alexis Gruden, age 4. Cynthia Clark, 8.
Wow, that young.
Yeah. And Samantha Sullivan described multiple forms of abuse she hid. Louise Osgood, physical abuse growing up. It's a heavy starting point that clearly shapes things for years.
And then layered on top of that, or maybe alongside it, is this huge range of mental health conditions and substance use issues.
Absolutely huge range. You see depression, anxiety, bipolar, PTSD, psychosis, various addictions, dissociative identity disorder.
Even physical conditions playing a role like DiGeorge syndrome or MS impacting mental health. Sheena Maynard, Robin L., Cynthia Clark. So many examples.
Right. Michael Pesci talks about bipolar onset after a serious physical illness. Kevin Flaherty, social anxiety. Kirk M. dealing with MS affecting memory and emotions. It just shows mental illness and addiction, they're not one size fits all. Not at all.
And the feeling that comes through so strongly, regardless of the diagnosis, is this sense of being isolated and ashamed.
Deeply misunderstood, yeah.
Yeah.
Judged, too. Sometimes even by family or maybe the first people they tried to get help from, which is heartbreaking.
Like Sheena Maynard feeling shame just for needing help.
Exactly. Or Robin L., whose husband blamed her illness on her. Samantha Sullivan felt invisible, rejected after an accident. Total loneliness.
And that anonymous author scared in a waiting room feeling judged. Plus those negative early hospital experiences, being pushed into group therapy when they needed something else.
Yeah, that initial contact with help can be so critical, and sometimes it just misses the mark.
It wasn't just internal struggles either, was it? Big life events often acted as triggers or made things worse.
Oh, for sure. Loss, grief,
Yeah.
losing parents, siblings, difficult relationships, divorces, serious physical injuries piling on. It's like life itself kept throwing curveballs.
And that connects to something else you mentioned from the NAMI source, the whole issue of stigma and misdiagnosis.
Yes, NAMI really focuses on the bipolar spectrum there. They highlight these awful stereotypes, that people with bipolar are untrustworthy or unpredictable.
Which just isn't true, especially with proper care.
Exactly. The NAMI authors who live with it themselves make that point strongly. And they talk about the danger of misdiagnosing bipolar 2 as just depression.
Because the treatments are different, right? Standard antidepressants can actually make bipolar symptoms worse.
Precisely.
Uh,
And that can lead to years, literally years, of unnecessary struggle. NAMI says the average delay for a correct bipolar 2 diagnosis is over 11 years.
11 years. Wow.
And often, they say the stigma itself, the way people are treated, is actually more painful than the illness.
So you've got this intense personal struggle, maybe trauma, diagnostic hurdles, stigma. It's an incredibly difficult place to start from.
It really is.
Okay, so acknowledging that depth, how did people start finding a way out? How did they find support?
Well, the paths were pretty varied. Formal treatment was a big one for many. Hospitals come up.
Yeah, sometimes tough experiences there, like we heard, but also places where people finally get the right kind of care.
Right. And therapy. Individual therapy, group therapy.
Yeah.
That was crucial for a lot of people.
Robin L. said it held her together early on. Someone else found a psychotherapist they could finally trust. Alexis Gruden pointed to a caring therapist as a major turning point.
Kevin Flaherty even described working on specific things like cognitive restructuring with a psychologist. So really targeted help sometimes.
And specific types of therapy, too, like DBT.
Yes. Dialectical behavior therapy. Several people mentioned how DBT taught them actual skills, like how to handle intense emotions without acting destructively, finding that wise mind, balancing logic and emotion.
Practical tools.
Very practical. And WRAP2, the Wellness Recovery Action Plan. That helped people build self-awareness, boost self-esteem, and figure out their own personal coping strategies. Tangible stuff for daily life.
Medication also comes up quite a bit. Often necessary, it sounds like, but not always simple.
No, definitely not simple. Finding the right medication, the right dose, that often took persistence. People had to advocate for themselves sometimes, say, this isn't working, or the side effects are too much. But always emphasizing doing that with medical guidance, of course.
Right. And then there are specific organizations, community programs. They seem like lifelines.
Huge lifelines. Places like the Western Connecticut Mental Health Network, WCMHN, where those stories came from. Their whole approach, based on choice, hope, access, new opportunities, growth, empowerment, that really resonated.
They offered classes, coping skills, managing anxiety.
Yeah, really practical support. And other places too, respite centers for short-term help during crisis, community centers for skills and connection, psychosocial clubs giving structure.
And you mentioned specialized centers like the Walker Center for Addiction Recovery. People called those life-saving.
They did. The testimonials were incredibly powerful. Caring staff, structured programs, getting families involved. And this is key follow-up support after leaving.
So it's about finding that right mix, isn't it? Clinical care, practical tools, supportive places.
Exactly. Which leads us straight into the next really critical piece. Connection. Support systems. And especially peer support. That just shines through everywhere.
Okay, let's talk about that. Family and friends obviously play a role.
For many, yes. Huge role. Partners, parents, siblings, friends, giving encouragement, practical help. Even if those relationships were complicated sometimes by the illness itself, that support was vital.
But the peer support aspect, that seems like a really powerful, consistent theme.
It really is. And this is where that Mental Health America source comes in, providing the hard evidence to back up what people are saying in their stories.
Okay, so let's break that down. Peer support, what exactly is it, and what's the impact?
So at its heart, it's help from people who've walked a similar path. People with lived experience of mental health conditions or substance abuse. It's that shared understanding.
Like finding people in AA or NA meetings who just get it.
Exactly. Or people volunteering on warm lines, those peer-to-peer phone support services. Or becoming actual certified peer specialists working within the mental health system.
So people who've navigated the challenges, helping others navigate them, and MHA has data showing this works.
Oh yeah, compelling data. Peer support significantly reduces hospitalizations. Like, really significantly.
How significant?
Well, studies found big drops in readmissions, fewer involuntary stays. One study showed people with a peer mentor stayed out of the hospital, on average, twice as long as those without one.
Twice as long. Wow, that's not just a statistic. That's people living more of their lives in the community.
Precisely. More time living, less time in crisis. And it also increases engagement with outpatient services.
So people are more likely to stick with therapy or other support if they have that peer connection?
It seems so. It builds trust, makes services feel less intimidating, more accessible maybe.
Does it help financially too? For the system or the individual?
Both, actually. The MHA source points to studies showing a return on investment for peer support programs. They save money, mainly by cutting down those expensive inpatient stays.
Makes sense.
And for individuals. It increases the chances of getting and keeping a job. Some people even transitioned off public assistance after becoming peer specialists themselves.
So it's effective on multiple levels. What about the human side? Hope. Quality of life.
That's where it really shines. And where the data and the stories just line up perfectly. Peer support is incredibly powerful for instilling hope.
Because you see someone who's actually done it.
Yeah.
Made it through.
Exactly. Living proof that recovery is possible. It fights that isolation, offers real empathy, builds community. MHA cites studies showing improved quality of life, fewer depressive symptoms, and critically, more hopefulness. Connecting with someone who truly understands, it fosters trust in yourself and the possibility of getting better.
Yeah, I can see how powerful that would be. Seeing someone thriving after similar struggles must be the ultimate motivator.
Absolutely. And the MHA source points out that because this evidence is so strong, most states now have certification standards for peer specialists. It's becoming a recognized, evidence-based part of care, often covered by Medicaid.
That's fantastic. It really validates what comes through in all those personal stories, that shared experience. The connection is vital.
It's a critical piece, no doubt about it.
Okay, which brings us sort of to the next phase, I guess. The sources talk about the journey continuing. It's not like you reach recovery and stop.
You know, that's a very clear message. It's an ongoing process. described as a journey one day at a time, needing constant effort. Robinell actually said, recovery, like life, is a journey, not a destination. I have to remind myself of that every day.
So persistence is key, resilience, learning from bumps in the road.
Definitely. People talked about hitting rough patches, stress, relationship problems, even relapse, but finding the strength to ask for help again or seeing it as a learning moment.
Like Cynthia Clark relapsing but finding her way back. Or Kimberly Sullivan reaching out right after a relapse.
Exactly. Setbacks don't mean failure. They're part of the journey, part of the learning.
And what about personal insights? What did people learn about themselves?
Self-awareness comes up a lot. Learning to spot triggers, those personal red flags. Understanding the difference between, say, an emotional reaction and a more rational thought.
Practical self-knowledge.
Yeah, and sometimes simple but profound things, like Robert Kimball realizing being a people pleaser wasn't actually helping him. It's about accepting yourself, owning your story, mistakes and all.
And finding purpose seems really important at this stage, too.
Hugely important. And often that purpose came from giving back, helping others.
The full circle thing again.
Totally. So many people went from getting help to being the help advocates, warm line workers, peer specialists, volunteers. Sheena Maynard wanting others to learn from her story. Michael Pesce calling his return to state service, helping others a victory. That shift is incredibly powerful and inspiring.
What about just day-to-day coping, healthy habits?
Yeah, people found all sorts of things that worked for them. Exercise, nature, art, writing, finding humor, quiet reflection, building a toolbox of healthy ways to manage stress and stay well.
So when you pull it all together, the overriding message from all these sources seems to be one of, well, hope, doesn't it? Things
Yeah.
can genuinely get better.
Absolutely. Moving from darkness to light, from just struggling to actually thriving. That anonymous author whose world regained color, who got independent, got a job, went back to school.
And that NAMI source title, Thriving on the Bipolar Spectrum, Changing the Narrative, that really captures it.
It really does. It's a direct challenge to those negative stereotypes. It shows that people with conditions like bipolar disorder, with the right support, can be thoughtful, creative, successful, loving individuals. It reframes the whole conversation.
It suggests a diagnosis doesn't have to define your limits at all.
Not at all. The NAMI authors, Sarah Schley and Devika Bhushan, are both successful professionals. They're living proof. They stress that thriving isn't just some vague possibility. It's happening. And sharing these stories is how we change perceptions and offer real hope.
This has been really illuminating, pulling together these different perspectives.
It really underscores that recovery is, well, it's complex, isn't it? It's different for everyone, but it is possible. It takes professional help, yes, but also diverse supports, personal effort, and that crucial element of connection, especially with peers.
And the MHA evidence really drives home that peer support isn't just a nice to have. It's genuinely transformative. It changes outcomes, challenges stigma, offers that vital hope.
Yeah, these sources together paint a picture of resilience, of vulnerability, and the incredible strength people find in community, in shared understanding.
They really show us not just that recovery is possible, but how it happens. Through being vulnerable, through connecting, finding strength maybe where you least expect it. It leaves you wondering, doesn't it? How can sharing and hearing more stories like these continue to change how we all think about mental health and just the power of human connection?